right, welcome back. Dr. Chris Blackman with Cone Health Ortho Care Greensboro is here today. We're talking about hips being achy and what do we do about that. Before we left for the break, we were talking about the do's and don'ts that people can do at home that may help with their hip pain. At what point should someone be thinking to themselves, okay, I might need surgery or something like that?
You know, I think if the conservative treatment fails in terms of rest, time, the oral anti-inflammatories, it's worth getting checked out to see, is it something that's surgical related? Most of the patients I see, you know, they come in with hip pain, surprisingly don't need surgery. They need something more invasive or less invasive, like physical therapy and injections and things. But x-rays can actually show if it's truly a hip issue, such as arthritis, that could lead to surgery such as a hip replacement.
Okay. Now, in some situations, we all have heard like steroid injections or creams are used. Are these long-term solutions, or are there limits to how long someone can use something like this?
Yeah, that's a great question. Most of those are short-term solutions, so to speak. If you get a steroid shot around the side of your hip where someone is experiencing tendonitis and bursitis, we may not want to repeat an injection like that for about 3 months. But it can help jumpstart your body to fight inflammation and feeling better, so you can get back to activities. The same thing with the topical anti-inflammatories as well. You know, you're going for the short term of feeling better, so hopefully the long term you can be active and get back to an active lifestyle, which just helps our bodies all over. It helps our physical health and our mental health.
Right, we all want to be active, but let's talk about some of the negative effects of what can happen on your health if you decide to put off even just going to the doctor for, you know, that achy joint pain, or when you're just totally putting off surgery altogether.
Well, I think, you know, when you're more stoic and you're not getting up and getting active, you know, it can lead to things like less muscle activity, you know, weight gain, other things that can contribute to you just not feeling well. It can affect your posture if you're not sitting up, you know, on your couch or your chair. If you're staying in a little reclined position, you know, those things can start detrimentally affecting your body. It can lead to pain in other areas, especially with your back and with posture. And we see that all the time, especially with arthritic hip, that it can radiate down to the knee and radiate to someone's back and can slowly keep them from being active, which, you know, if they need an active lifestyle, say if their blood pressure is running high and their cardiologist or their primary care doctor is recommending, you know, more walking and increased cardiac related activities, that can keep them from doing things.
Right. And I think we think of surgery sometimes as a scary thing, but really the hip surgery, as you're talking about it, leads to more health benefits.
Yeah, correct. I think if someone gets a hip replacement, and we've recommended that, I think the positive things are it helps with their mobility, it decreases their pain, and it improves their quality of life. And that's why we do what we do if it comes to that type of intervention. And I've seen hip replacements decrease someone's back pain and knee pain and help them get really more active in getting out there and have good quality of life.
All right, we got about a minute left. If someone does have an aching hip joint, that kind of thing, do they go to their primary caregiver? Do they go to the orthopedic directly? What do they need to do?
Yeah, that's a great question too. You know, a lot of people will see their primary care physician first because the primary care physicians have an idea of what medications they've been on, what can they take and can't they take, and they do a good physical exam as well, and then they get those patients our way if they feel like, hey, we've tried the conservative things, we need to go to the next step to see, is an x-ray appropriate, is other therapy appropriate, are injections appropriate, and that's where it comes into our hands as far as guiding that treatment.
All right, so start with your primary care doctor, and of course you can go on the list of Cone Health, and they've got all of the lists of primary care doctors. If you don't have one since COVID, you are able to find one. Thank you, doctor, for joining us. We appreciate it.
Oh, thank you very much for having me.
All right, now if you missed any of this, or maybe a family member is dealing with this kind of pain, they should watch this later on. You can go to our website. It's in the To Your Wellbeing section.